On this Saturday night, the range of responses to the rapid spread of Omicron. From shorter isolation to booster shots coming sooner.
Shorter incubation period means that people are infectious earlier.
Why one province isn't reimposing restrictions. Plus, scaled back New Year's celebrations in the U.S. as COVID-19 cases surge.
Our hospitals are at roughly the same numbers they were on the worst day of last winter.
And residents return home to ruins after a ferocious Colorado wildfire forces tens of thousands to flee over the holidays.
Global National, reporting tonight, Nitu Garcha.
Good evening and thanks for joining us. Canadians are starting off the new year on a high that no one wanted. Record COVID-19 case numbers are still being seen across the country, prompting several provinces to tighten restrictions and extend the winter break. But there is the growing consensus the Omicron variant causes milder illnesses with a shorter incubation period. While more Canadians are getting infected, the isolation period for some is getting shorter. Ross Lord has our top story tonight.
With the number of new COVID-19 cases reaching record highs every day, even those leading Canada's response are feeling the impact. The latest to be infected, New Brunswick Premier Blaine Higgs, despite being fully vaccinated, including a booster shot.
Several days ago, I came down with a cold, what seemed to be cold symptoms in any way. Wednesday morning, I did a test, and it came back positive.
Confronting an exploding case count, New Brunswick is postponing non-urgent surgeries. It's also reducing isolation periods to 5 days, joining a growing list of other provinces, including British Columbia.
What we're seeing with Omicron is that shorter incubation period means that people are infectious earlier, from 1 to 2 days before their symptoms start, and that the illness tends to resolve more quickly.
Other movements gaining momentum, fast-tracking booster shots, and making healthcare workers and the most vulnerable the priority for PCR tests, now that the virus has overwhelmed testing capacity.
So use the capacity you have in the smartest possible manner and focus it on areas that you need it the most.
Responses to the Omicron wave are all over the map, from Quebec imposing a curfew and closing restaurant dining rooms to Saskatchewan rejecting calls to introduce new gathering restrictions.
I've never seen a situation where we are in the throes of extreme exponential growth, where we're threatening restrictions and possibly even lockdowns and talking to school closures, and yet the restaurants are full, the malls are full, we have people who are throwing parties.
Dio Nandan says the best new measure governments can take against Omicron is universal paid sick leave, limiting transmission by making it easier for working-class Canadians to stay home. British Columbia is starting 2022 by providing 5 days of paid sick leave. Similar protection for workers in private industries that are federally regulated still has no start date. Ross Lord, Global News.
And as Ross mentioned, Saskatchewan is one of the few provinces choosing not to impose new restrictions despite record high case numbers. But as cases rise, there is concern they will cause a strain on hospitals and the burden will fall once again on healthcare workers. Nathaniel Dove reports.
New Year's Day is normally filled with optimism, but one Saskatchewan doctor is very worried about what 2022 will bring.
We pretty much know what it's going to look like. There's going to be a ton of cases. There's going to be a ton of outbreaks.
There were no gathering restrictions over the holidays in Saskatchewan. Instead, the government is preaching personal responsibility. Dr. Alex Wong says that didn't work out well last year, especially when the Delta variant pummeled the province. ICUs were so overloaded, patients had to be transferred to Ontario.
We're going to be in the exact same situation that we were in with Alpha and Delta, where we're scrambling, where we're having to do all kinds of horrible things in terms of compromising care acutely for critically ill people.
Omicron appears to be milder than Delta, but it spreads quickly. More cases means more care, which means more strain on a healthcare system that's still recovering from a devastating fourth wave. Saskatchewan ended 2021 with a new record high daily case count, but Premier Scott Moe says the focus, for now, is on hospital and ICU admissions. An epidemiologist believes those numbers will soon start increasing.
It will start to go up, and when it starts to go up, to do things then is a little bit too late.
All of the outbreaks that are going to occur in schools all these other pieces are, extremely damaging to society.
Not the start to the new year anyone was hoping for. Nathaniel Dove, Global News, Saskatoon.
The U.S. is ringing in the new year with doctors warning of a blizzard of new COVID-19 cases. While many New Year's Eve celebrations were scaled back or canceled, millions attended events in major cities. As Jennifer Johnson reports, medical experts say the country's healthcare system is going to pay the price.
The iconic ball drop in Times Square with 1/4 of the usual crowd, all masked and vaccinated. The city is facing a huge uptick in COVID-19 cases, forcing everything from Broadway to businesses to some subway routes to shut down. The new mayor promises things will get better.
Not only am I physically walking into City Hall, but hope is walking into City Hall.
But there were no restrictions in Las Vegas, where about 300,000 people cheered along the Strip. Or places like Idaho, where a large, unmasked crowd watched the famous potato drop. With the Omicron variant spreading like wildfire, healthcare workers are bracing for what's coming in early 2022. More than 2 million new COVID-19 cases were reported this past week.
Today, we broke our single-day record for COVID admissions. This is really a frightening scenario.
Almost every governor in the U.S. has had to call up the National Guard to help in hospitals and testing sites.
Our hospitals right now are at roughly the same numbers they were on the worst day of last winter's surge.
This Kaiser Permanente Rose Parade float tells the story of just how bad the situation is. It never made it out of the warehouse after medical workers slated to ride on it were told to go back to their hospitals. The new year starting on an ominous note for those on the front lines. Jennifer Johnson, Global News, Washington.
Coming up, the New Year's rush that sparked a deadly stampede at an Indian shrine.
Because we shared him with the world, you shared part of the love you held for him with us.
Archbishop Desmond Tutu's daughter shared her family's gratitude to mourners around the world as the South African anti-apartheid hero and Nobel Peace Prize winner was laid to rest in Cape Town. Remembered as the country's national conscience, Tutu passed away on Sunday at the age of 90. A New Year's Day stampede has killed at least 12 people at one of India's holiest Hindu sites. 15 others were also injured during the crowd surge at the Vaishno Devi shrine in Indian-controlled Kashmir, where tens of thousands of Hindus gathered for a pilgrimage. Initial reports suggest a scuffle between some devotees may have led to the crush. An investigation is underway to determine an official cause. In Colorado, heavy snow and frigid temperatures overnight helped extinguish the most destructive wildfire in the state's history. But the weather is adding to the despair of hundreds of residents trying to salvage what remains of their homes. The rare winter wildfire, fueled by a windstorm, tore through the suburbs north of Denver on Thursday. 2 people are missing and more than 500 homes destroyed. Mary Simon in her own words. Ahead, what's on the agenda for Canada's first Indigenous Governor General? In a year where Canadians confronted the painful reality of the country's treatment of Indigenous peoples, there was also a historic first. Mary Simon was appointed as Governor General, the first Indigenous person to become the Queen's representative in Canada. In a special interview airing tomorrow on the West Block, Her Excellency Mary Simon says she is used to living in 2 worlds, and it's her goal to bring Canadians together. Mercedes Stevenson brings us more from her conversation with the Governor General.
Governor General Mary Simon understands the North. It is, after all, where she grew up. There she learned important lessons, especially from her grandmother. Lessons that guide her now in her role as Canada's Governor General.
She would say a word, it's ayuinata, and it means commitment, let's keep going, don't give up. And that was always a word that we used in our family, but it's also used every day in my culture, in the Inuit culture.
Simon is making history as the first Indigenous Governor General, and she wants to be a unifying force for Canada, an embodiment for reconciliation. A journey that she says must be accelerated and engaged in by all Canadians. A critically important step forward, according to Simon, is fixing the inequalities in education faced by Indigenous youth, especially in the North.
Down here you have the opportunity to stay home or to go away. The up north or in remote areas, you don't have that choice. If you want to go to post-secondary education, you have to move away. And Indigenous people are a very close-knit family, and it's difficult for people to move away, and especially when young people have families when they are quite young.
Someday, Her Excellency Mary Simon would like to see a northern university and Indigenous post-secondary institutions. Simon believes the discovery of unmarked residential graves made the wrongs of the past much more real in the minds of Canadians this year. But she says reconciliation isn't just about what governments can do to address the issue.
There's also the relationship building that has to occur between people, individuals, and other, cultures and other societies have to build a better relationship, a better understanding, have more respect for each other.
Simon was also blunt about her view of the mental health care system in Canada, its importance and its lack of resources. Two things she hopes to shine a light on, saying it is critically important under the strain of the COVID-19 pandemic and key to addressing the tragedy of the high suicide rate in northern communities.
So as a country, we have put a lot of emphasis on physical health, and we're able to get the kind of treatment we need in terms of our physical well-being. But in terms of our mental health, it's very much on a much lower standard of health care, and we need to address that.
You can catch our full conversation with Governor General Mary Simon coming up on the West Block. Mercedes Stevenson, Global News, Ottawa.